For many patients, it is not trivial to obtain tissue on which to then use in a DNA panel test to look at the mutational profiles within a given tumor. So for those patients, a liquid biopsy, looking at circulating free tumor DNA within the serum of a patient, is an option. This involves taking a blood sample, shipping the tube to a specialty laboratory on which the DNA is extracted, and then DNA that is circulating in that matrix is evaluated. So this will include normal DNA that is shed from the normal tissues, from the white blood cells, etc., as well as tumor DNA that can be seen because of its presence of mutations that are not otherwise evident from the normal DNA. The fraction of tumor DNA to normal DNA is very small. It's common for it to be less than 1%, and therefore one is looking at a very specific needle in a haystack in order to find that data. One of the most commonly applied tests for liquid biopsy is from Guardant Health, the Guardant 360 test. This test looks at a panel of genes that are commonly used for making therapeutic decisions, and then allowing one to decide, should that therapy be a prominent option for the patient? Should that therapy be deprioritized because of resistance factors? Or are there therapies that one wasn't even aware of that could be prominent and available? There are limitations to liquid biopsy. As I mentioned, there's a small amount of DNA, as it's also difficult to measure certain types of changes that occur. If there's a gene fusion variation, for example, often that's easier to measure by an RNA transcript rather than a DNA transcript, but isolating RNA from a liquid biopsy is more difficult than isolating DNA. Also, there are variants of unknown significance that will be identified. These can still have some value in the presence of a liquid biopsy, in that one can monitor their abundance over time and look at the longitudinal picture, even if that particular variant is not therapeutically actionable. So overall, liquid biopsy, such as the Guardant 360 test, allows you to go in and evaluate a patient, the presence of mutations that may be of therapeutic relevance, the longitudinal changes that have occurred if you're obtaining these liquid biopsies on multiple occasions, and then really understand how these changes are affecting the current therapies that one are using. So if you see a resistance mutation begin to emerge over time, one can prepare to switch to a different therapy, or at least to stop using the current therapy as one goes forward. Insights that you would not obtain from a CT scan, or even from a tissue biopsy in many cases. And so there's a lot of utility becoming unveiled for these so-called liquid biopsies.